Imagine it's 10 at night. You suddenly develop severe stomach pain. Your family says it's probably just gas. Take this painkiller and sleep. You take the painkiller, the pain reduces. Next morning, it is suddenly worse. By the time you reach the hospital, the real problem has already progressed. Unfortunately, I see this situation more often than people realize. Not every stomach pain is dangerous. Not every stomach pain is just gas either. In this video, I'll explain why taking random painkillers can delay the correct diagnosis, the warning signs and symptoms, and you should never ignore when you should seek medical advice or care. Stay until the end because I'll also explain stomach pains that need emergency evaluation. Hello, I'm Dr. Rajeev Pullagura, Consultant General and Laparoscopic Surgeon in Bangalore. Every week, I see patients who tell me, Doctor, the pain reduced after taking a tablet. So I thought everything was fine. But sometimes the tablet only reduces the symptoms, not the underlying problem. It does not treat it. Let's understand why. When some people say they have stomach pain, they are often talking about pain anywhere in the whole abdomen. But the pain can come from many different organs: your liver, spleen, the stomach, the intestine, the appendix, the gallbladder, as well as your kidneys. That's why two people with stomach pain may have completely different conditions. Can the same stomach pain mean 6 different diseases? Yes, that's why guessing can be very, very risky. Pain is not your enemy. Pain is your body's way of asking for attention. Imagine the warning lights of your car dashboard is disabled. If you simply cover the lights with a tape, the engine probably doesn't disappear. In the same way, a painkiller may reduce the discomfort, but it does not automatically treat the cause. One of the biggest misunderstanding is this: Doctor, the pain went away after I took the tablet, so everything must be okay. Not necessarily. Some conditions cause pain that comes and goes. Some others improve temporarily and then they return back. That's why repeated pain deserves immediate medical attention and help. Pain reduced doesn't equate to problem solved. Again, pain reduced doesn't equate to problem solved. Let's look at some common examples like acidity, that is burning in the upper abdomen, gas, bloating, or discomfort that may improve after passing some amount of gas or sometimes even after stools. Gallbladder stones, pain in the right side of the upper abdomen, often after a heavy fatty meal like a pizza. Appendix, pain that often starts near the belly button and then moves to the right lower part of the abdomen. Kidney stones, pain beginning in the back or the sides of your back and then moving towards your groin. Food poisoning, pain with sometimes vomiting and sometimes loose stools. As you can see, the treatment for each of these conditions is different. That's why the cause matters. Many people are surprised to learn that some painkillers can also affect the stomach itself. In certain people, they may irritate the lining of the stomach. They can worsen acidity. They may aggravate ulcers, and in some situations, they can increase the risk of stomach bleeding or something called as perforation. This does not mean painkillers are bad medications. They have to be used very carefully and prescribed at the appropriate time. The problem is taking them repeatedly without understanding why the pain is happening. Now, common mistakes: taking painkillers without knowing the cause. Mistake number 2. Taking tablets suggested by friends and relatives, one of the dangerous and most commonly heard thing. Buying medications every time from the pharmacy without a proper medical evaluation by a doctor. Another common mistake: ignoring pain because it improved once. Calling every stomach pain gas. And then this is the most common mistake I hear in my clinical practice. Now, let's discuss the symptoms that should never be ignored, never at all. Severe pain, pain getting worse, pain moving right lower part of the abdomen or moving from one side to the other, persistent vomiting, fever, any sort of black stools, blood in vomitus or stool, yellow eyes with abdominal pain, swollen or bloated abdomen, inability to pass stool or gas, severe pain during pregnancy, elderly patients with sudden new abdominal pain, diabetic patients with abdominal pain. If these symptoms are present, do not rely on home remedies or repeated painkillers. Seek medical evaluation promptly. So, what should you do if you develop stomach pain? First, don't panic. Try to notice where the pain is, when it started, whether it is associated with any vomiting, fever, diarrhea, during urination or eating certain type of food. Drink water if appropriate. Rest and avoid heavy meals until you understand what's happening. But if the pain is severe, worsening, or associated with any of the warning signs described, do not delay. Seek urgent medical care. I want to remind one simple message. A painkiller can reduce pain, but it cannot tell you why the pain has happened. Treating symptoms without understanding the cause may delay the right diagnosis. Most stomach pains is not life-threatening, but some conditions do need timely treatment and emergency treatment. If the pain is severe, usually recurrent or accompanied by warning signs previously described, let a qualified doctor evaluate it. Early diagnosis is often safer than delayed treatment. If you found this video useful, please like it and subscribe for more evidence-based information about common surgical and medical conditions and abdominal health. Have you ever ignored stomach pain because you know it was just gas? Let me know in the comments. Your experience might help someone else seek care earlier. Thank you for watching, and I'll see you in my next video. Thank you.